I want to thank all the witnesses for your testimony. We will now move to questioning. I will begin and recognize myself for 5 minutes. Mr. Massa, when looking at how your OPO handled the index case from the HRSA report, very simply, yes or no, do you still maintain the assertion from your testimony that all of the relevant OPTN policy, regulation, statute, and rule were followed by CODA in the handling of the DCD case?
My apologies. Thank you, Chairman Joyce, for your question. That case was very complex and during a very complex time. If you recall, in 2021, we were in the midst of COVID. And I think that impacted the communication that we had within between our hospital and our team. And while I'm not using that as an excuse, I do think it added to the complexity of it. With that said, we know that a successful donation experience happens when there is frequent communication. And I think in that case, in this case that we're talking about, the communication could have been vastly improved.
And if that communication wasn't where it should have been, can you say yes or no? Was policy, regulation, statute, and rule, was that followed?
The DCD process was followed, yes, sir. But again, I think—
In light of the horrific pain and suffering that the index patient endured, do you agree then, if it was followed, and what we have read about this case, do you think that stricter standards need to be in place so that patient safety, so that we never hear again about a patient suffering this horrific pain?
We never want another experience like this as well. And
So
we are
do you
going
think
to
that
administer—
yes or no, do you think that stricter standards should be in place?
We are going to follow the recommendations of HRSA, and we are glad to have more oversight to make sure that we restore the public trust.
Mr. Massa, moving on, and we've heard this from Dr. Lynch's testimony today. Do you or anyone in your organization play a role in retaliation against the incident reporter in the index case who, according to the HRSA report, was fired from another job in the organ transplant space following outreach from CODA just 2 days after this committee's hearing last year when the index case was first discussed?
No, sir. If you look at the facts, I welcome every member of the subcommittee to look at the actual facts of that case or of that situation. There was no retaliation. If there was retaliation, that would not be tolerated within Network for Hope.
As the individual who is now in charge of the OPO, have you looked into any possible retaliation against this, retroactively looked at any retaliation against this or any other whistleblowers?
I have.
And what have you found?
I found that in this case, specifically that we're talking about, there was no retaliation, and I go back to the letters that we sent to this committee on December 17th and January 3rd in response to that.
Will you commit to us that if there is any incident that would occur in the future and it will be brought to the attention that there will be no retaliation, that you will work to make sure that those who bring these cases forward, where someone is undergoing addition and moving forward in the transplant process and is not felt to be an appropriate candidate, that there will be no efforts of retaliation against that individual?
That is correct, and I could tell you that we have a policy in place that not only the expectation is to bring that forward, but it says in the policy it is an obligation for anyone.
Thank you for
on our
that
team.
commitment, and thank you for that obligation. Dr. Formica, it has been alleged that the OPTN has a history of dismissing and downplaying serious allegations of risk to patient safety, like in oversight of the index case, where you dismissed nearly proceedings with organ harvesting on a patient who ultimately was discharged from the hospital alive. And I'm quoting, you said, "a nice story for the patient." Yes or no? Did the OPTN, under your leadership, adequately investigate and respond to all reported concerns?
Chairman, I think this case highlights some of the challenges we face in the OPTN. I learned of this case after The MPSC had decided not to pursue that when HRSA instructed us to begin the larger investigation. In retrospect, had I heard about that sooner, because I'm aware of the larger context of what's going on right now, I would have asked for a deeper
So
investigation.
why did HRSA need to direct the OPTN to reopen their investigation of CODA and eventually issue a corrective action plan dictating how further action must be handled?
I think that demonstrates the collaborative nature between the OPTN and HRSA, frankly, and I think that's why it works well.
But
the
if the
OPTN
safeguards were in place, would that have needed to occur?
The OPTN is composed of volunteers who are also conducting their normal day jobs, and we're facilitated by contractors that help provide the infrastructure around which we provide our work. As we've moved through the transition period, some of that fluid communication back and forth has taken some time to work out new pathways.
But you have all talked about trust, and now that trust has been violated. I think it's been fractured. Do you feel that that lack of communication that existed continues to exist today?
I actually think it's getting better every day. When you've moved from an environment where you have one contractor facilitating all the activities of the OPTN to multiple contractors now facilitating that, it takes some time to work out the pathways.
I think it is clear to all of us on this committee, both sides of the aisle, that that communication needs to improve, that collaboration needs to improve, and that there needs to be the safety of the patients that ultimately guides whether or not they are viable candidates for the transplants that are so necessary for the health of so many Americans. I thank the panel for being here today. I now yield